looking for consensual response here. Good, go ahead and look up for me. And just briefly down.
Green. 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 Orange. Yes. 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 Left to right. Right.
Good.
Right. Or left to right.
Very good.
2. 2. 1. 1. 2. Both.
Good.
Like jawline.
Very good.
Ear. Nose. Cold. 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 1. 2. 1. 2. 2. 1. 1. Now. 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 Now.
I have you scheduled for just a very basic cranial nerve exam. It looks like we're just going to be testing your 12 cranial nerves, making sure that everything is functioning appropriately. So I didn't see anything in your notes that said there was anything specific going on. It doesn't look like there are any specific complaints or ailments today, at least not that I have documented here. Is there anything that you were particularly concerned about?
No, it's been a while since my last checkup, so I wanted to make sure.
Just make sure. Okay.
In order.
Good. Well, I'm glad that you are on top of everything. It's always good to kind of do a once over and make sure that everything's functioning appropriately. So it looks like your last, let's see, about 3 years ago was your last one. So you are just a little bit overdue, but that's okay. Obviously, you're fairly young and in good health. So ideally, we do like to do a general cranial nerve exam physical assessment about once a year. So just something to keep in mind for the future. Now, I'm going to ask you just a general series of questions here. Are you feeling generally well today, unwell?
No, correct today.
Have you been sick at all recently? Cold, flu, sinus infection?
No, not recently. It's been a while since I've had my last one.
Okay, about how long ago would you say?
Maybe at the start of this year.
Okay, so quite a few months then, 6, 7 months now. All right. So no recent surgeries or any injuries?
No.
Okay. All right, and when is the last time you visited your dentist or orthodontist?
Just quite literally recent.
Okay, so you
Like
just had that done.
week.
Good, okay. So you're on time with that, which is very good. Did they find anything of concern?
Well, everything was great. No cavities, and my wisdom teeth were perfectly fine.
Very good. So that is obviously really good news. And what about any ophthalmology exams? Have you seen your optometrist recently?
Not recently. I need to schedule an appointment.
Do you wear glasses or corrective?
contacts
You
in
do
right
wear
now.
contacts. Okay. Do you feel like your prescription is still up to date?
Yes.
Okay. Do you know by chance the last time you saw your optometrist?
Probably last year.
Okay, so not super overdue. That's okay. And you do have a regular optometrist that you see? Okay. All right, so that's very good. Now those corrective lenses, do you know if they're for nearsightedness, farsightedness?
I always forget. I think it's.
Do you have trouble seeing far away or trouble seeing up close?
Or they're so nearsighted.
It's a little confusing. It's kind of
Yes.
backwards. That's okay. All right, so that's just something to note. Just want to make sure you're not sleeping with your contacts in. It is very important that you take them out. All right, good. Any aches or pains today? Headache, migraine, any pain anywhere? Muscle straining, anything?
No.
Good. Okay. Are Are you still working at the same place? I have that you have a pretty physically active job.
Yes, same place.
Okay. All right. Any issues with your diet? Do you feel like you're eating pretty well, prioritizing whole foods, fiber? Good. And then obviously drinking enough water is very important. Now we are coming into about midsummer and it is fairly hot outside, so do you want to make sure that you're wearing sunscreen on your face and any parts of your body that are exposed for more than 15 minutes. All right, so we kind of have gone over everything as far as your general updates here. Is there anything that you wanted to mention before we get started?
No, just been here for the checkup.
Okay, perfect. So we can go ahead and begin. Let me just set this aside. All right, so I'm just going to clean my hands first, of course, with some sanitizer, and then we will begin. I have a couple things we're going to be going over. It's nothing super invasive. So this is mostly going to be examination of your cranial nerves, like I said. So testing things like your eyes, your ability to see things, your color vision. You're not color deficient, correct? No. Okay. Maybe just a bit of visual acuity. You do have a regular optometrist and you feel like your contacts are still working, so that's fine. I will do a brief test of your sense of smell, excuse me. Of course, your sensation test, which is very important to make sure that you're feeling things appropriately. So I have a couple different kinds of stimuli that I will be touching your skin with at some points in the examination. And then, of course, just having a general look inside your eyes. Okay? All right, so we can go ahead and get started. Now, I typically like to start with just a visual inspection, so I'm just going to kind of have a look at you, see if there's anything I notice outwardly that could be abnormal. Is it okay if I touch you? Just, okay. So I'm just going to have a look here. So I'm kind of just looking at your overall posture as well as your bone structure here of the clavicle, looking at the arms, as well as at your skin tone and texture of the face. Not noting any wasting at the musculature here above the eyebrows, and no signs of asymmetry at the face, which is good. Also not noting any drooping at the mouth. External ears look good. So you do have some piercings here that do look like they're healed. If I could just have you sit up straight for me, shoulders tall. Any pain or discomfort in the back? Good, okay. So posture and overall alignment is fairly symmetrical there, so that's very good. All right, so while I have my pen light out, I'm gonna go ahead and test your pupillary reaction. So basically just gonna shine my light briefly in your eyes. Your pupils should constrict and dilate appropriately, so it is very bright. I do apologize. What I'm gonna do is have you look here at the cabinet, and I'm just gonna shine this in your eyes so you can blink as necessary. Good. Very good. And just checking for consensual response here. Good. Good. Any blurry vision there? It is quite bright. I do apologize. So give your eyes just a second. I like to go ahead and get the lighted test out of the way. That way you don't have to have a light shining in your eye at different points throughout the examination. So I'm just going to fight with my ophthalmoscope and get this set up for you. So this is a bit of a dimmer light, but I am going to be coming quite a bit closer to your face. So this is going to allow me to have a look at your optic nerve, at your optic disc, and all the functions inside your eye that allow you to see. So I'm just going to have you look here. I'm going to come closer in and just gently pull down at the eyelid, following the optic nerve, and I have visualized the optic disc. It does appear clear, not noting any abnormality there. Can I have you look up for me? Good. And look down. Perfect. Okay. So same thing this time. I'm going to have you look here for me. And coming in. Good. So optic disc is visualized. Good, go ahead and look up for me. And just briefly down. Very good. Okay, so very good sign. No abnormal redness or anything like that. Everything looks healthy. You never notice any kind of overproduction of tears or dryness of the eye?
Maybe a little dryness.
A little
it's mostly
dryness?
when I'm like tired and exhausted.
Okay, so after a long day, yeah, that can be normal. So it's certainly okay to use moisturizing eye drops. I would just be careful because with overuse, your eyes can become dependent on them and then you'll stop producing that normal fluid of the eye. So if you're having a day where they just feel particularly dry, it's okay to use them. I just wouldn't make a habit of using it just because. Okay? All right, so I've switched over to my otoscope here. Now I am going to use this to have a look at your ears, but I'm going to start by just having you follow the light. So this is just going to allow me to test your ability to track. So what we're going to do is have you keep your head midline here. So don't move your head. We're just going to move our eyes. Okay? So follow the light for me. Very good. Very good. Okay, so no issue with that, no delay or anything. All of that looked very good. So we can go ahead and continue moving down. Now, I'm going to stay in line with your eye exam. So just a brief test for visual acuity. There are some words here. Can you read this for me?
Pretty feelings.
Very good. So no issue, no blurriness here. You can see that well. Good. All right. So let's go ahead and test your color blindness. Now I'm going to do this a couple different ways. It's likely by now you would know whether or not you were colorblind, but I do like to go ahead and test it anyway. So I'll do these 4 and these here. Okay, all right. So I've got a couple pens here, very normal colors that you've seen. You don't have to try to tell me the specific shade, just the general color range. So can you tell me what color this is here?
Pink.
And here.
Green.
Good. And I apologize for the ambulance. My office
Red.
is fairly close to the emergency room there.
And then blue.
Good. Now, of these 2 here, can you tell me which color is just slightly more prominent than the other?
The blue.
Okay. And here?
The pink.
The pink. Okay, good. All right. Okay, so similar here. You identify the color.
Blue.
Good.
Orange.
Good.
Green.
Very good. Okay. So I am going to use 2 of these. Can you see that this is green at this distance? And can you see that this is orange?
Yes.
Okay. So I'm going to bring these into your visual field. When you see the color, I'd like you to just identify it by saying green or orange.
Okay.
Okay?
Green. 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 Orange. Orange. Orange.
Good. Let me know when you can see both at the same time.
Now. Now. Now.
Good. And tell me when it comes into your visual field.
Now.
Good.
Now.
Good. Look at the orange. And now look at the green. And look at the green. And now at the orange. And look at the orange. Look at the orange. Don't look at the green. And now look at the green. Very good. Okay, so very good pupillary accommodation there. Okay. All right, Samantha, you are doing really well. So let's go ahead and move on. I am going to just have a brief look in your nose. So just having a look at the nares. Do you ever have any issues with allergies, seasonal allergies?
Seasonal allergies on the
Just a
patient.
little puffiness? Okay. So it shouldn't be as bad now that we're in summertime, but probably was a little worse in the spring.
Mm-hmm.
Okay. So just help you tilt your head slightly for me. Okay. Not seeing any signs of occlusion there. No pinkening. Very good. Okay. So I'm going to have you open. Good, and say ah. Stick your tongue out for me. Up to the roof of your mouth. Good, okay. All right, so let's go ahead and do a brief test of your sense of smell. So a very common smell here.
It's like sanitizer.
Okay, yes, it is alcohol, rubbing alcohol. Fairly strong. Very good. Okay, and why don't we go ahead and move on to having a look at your ears. So I'm going to use my otoscope here and have a look at your ear. Do you ever have any issues with your ears or your hearing?
No.
Good. All right, so I'm just going to have a look at the ear here. Externally, everything looks fine. I'm not noting any earwax that's protruding outside the ear canal, which is good. And eardrum is clear. No signs of extra earwax there. Good. Okay. So same thing on this side. Beautiful earrings.
Thank you.
And close here. Good. Okay. So no extra earwax or anything. Do you tend to use Q-tips to clean your ears? Okay. So just be careful. Be mindful that you're not putting them too far in your ear. As long as you're just kind of gently using them externally, it should be okay. All right. Alrighty, let's go ahead and move on. Now, since we did visualize your ears, why don't we go ahead and test your hearing? Now, you said you don't usually have any issues with your hearing. Do you frequent any loud events, concerts, that kind of thing?
Concerts.
Okay. So just be mindful if you're going to too many, it can start to affect your hearing. They do have special earplugs that you can wear to still hear the concert. Obviously, it does diminish the experience just slightly, but just something to be mindful of, as well as wearing headphones or earbuds. You don't want to have the sound too loud there. Okay? All right. So I'm going to test your hearing a couple different ways. Now, the first is that I am going to produce a noise. Now, you tell me if you can hear this. Mm-hmm. Okay, so I'm just going to produce a sound here. I want you to just say yes if you hear it.
Yes. Yes.
Good.
Yes.
Good. I'm just going to feel my hand here.
Yes.
Good.
Yes. 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 Yes.
Very good. Okay. All right. Now I'm going to make another sound, this time testing your directional hearing, and this is a little bit quieter. So I'm going to start on one side and come over. I want you to tell me where it starts and where it stops.
Okay.
Okay?
Right to left.
Good.
Left to right. Right.
Good.
Right. Or left to right.
Very good.
Left to right.
Good. Okay. All right. Now I have two similar sounds, but also distinctly different. So we're going to say this is sound 1, and this is sound 2. Can you tell the difference between the two? Okay. So I'm going to do 1 or 2, and I will vary, and I'd like you to just say 1 or 2 based on what you hear.
Okay. 1, 2.
Good.
2, 1, 1, 2, 2, 2, 1, 1, 2, both,
Good.
both, 2, 1, both.
Very good. Okay. So there's likely no issues with your hearing. You did very well even on the ones that were very quiet. So that is good. All right, so we can go ahead and move on. You're doing really well. Now, this next test is going to test a couple different cranial nerves for you. I have a few different objects here. So I'm going to ask you to close your eyes. I'm going to place an object in your hand to start with. I want you to just try to identify the object. Okay.
Like a clip.
Good.
carabiner.
Very good.
Paperclip.
Very good.
Another itty bitty clip.
Very good. So now I'm going to hand you this object here. I want you to tell me if it's bigger or smaller than a previous item I handed you.
Smaller.
Good. Same with this, bigger or smaller.
Smaller.
Very good. I'm going to hand you two objects. I'd like you to tell me if they are the same or different.
Different.
Good. And same or different item, size does not matter.
Same.
Good. Very good. And last one, are these the same or are they different?
Different.
Very good. Okay, you can go ahead and open your eyes. So you did really well. Just test your mind's ability to feel for a familiar object without you being able to see it. So you did really well there. It's a little tricky because they are identical, but just different sizes. All right. Okay, so let's go ahead and move on. Now, I think what I'd like to do next is do a test for bone conduction. Now, don't so much pay attention to the sound. I want you to tell me if you feel the vibration. So if I do it here on your knee, you should feel that that's vibrating.
Mm-hmm.
Good. You feel vibration here?
Yes.
Good. Okay. You feel vibration here
Yes.
and here
Yes.
and here.
Yes.
Good.
Yes. Yes.
Okay.
Yes, but it stopped.
Very good. And here.
Yes.
Okay, good. All right. So I'm going to go ahead and test a few components of your sensory function. So there are several nerve endings all over your body, some areas more than others. So I'm going to be touching you with a couple different objects. Now to start with, I want to just test your ability to perceive sensation. So for example, if I touch you here, you should be able to feel that I'm touching your shoulder. So I'm going to touch you in various areas. I want you to just tell me where you feel it. So it doesn't have to be super specific, just forehead, cheek, etc. Okay?
Chest.
Good.
Shoulder. Like jawline.
Very good.
Ear. Nose. Elbow. Wait, what is with my thigh or calf?
Your thigh. Very good.
Under my chin.
Good. Okay. So basic ability to perceive stimuli is intact. Now I'm going to test that with a couple different textures and sensations. So we will start with cold. Now this is very cold. I do apologize. I'm going to just briefly touch it to your skin. I want you to tell me if it feels cold and if any of the areas start to feel less cold. Okay? Feel the cold there.
Cold. 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 Cold.
Good. Now can you tell me if this feels any more or less cold than this side?
It's the same.
Same. And here and here.
Same. Same.
Good. No difference here and here.
No.
Very good. Okay. Now I'm going to do a variation of two different sensations. Now, this has a silicone tip on it, so it's just kind of dull. You feel that?
Mm-hmm.
Okay. Now, do you feel that this is just slightly more blunted, sharp? Okay. So we will say that this is 1 and this is 2. And again, just indicate which you feel.
1, 2, 1, 2, 1, 1, 2, 1. Can you do that again?
Sure.
1, 1, 1, 2, 1, 1, 2, 1, 1, 2, 2.
Okay, you can go ahead and open your eyes. So we did have quite a few discrepancies there, specifically around the forehead area. So I am going to try to test that again. This time, let's do something that's just a little more distinct. So I have two different things here. One is obviously very sharp. Now I'm not going to be puncturing your skin or poking you very hard, but you should feel that this is pretty sharp. And this one is more soft. So we will say that this is 1 and this is 2. Okay.
1 or 2, sorry.
Good.
1, 2. 1, 1, 2, 1, 2, 2, 1, 1, 2, 2, 1, 1, 2.
Good. Okay. So you did a lot better with that one. It could just be that these are very similar. Now, obviously when your eyes are open, it's quite easy to tell the difference, but when your eyes are closed, it's a little bit more difficult. So that's okay. Just want to make sure that there's no lack of sensation or loss of sensation here, so you can feel all of this appropriately. And there's no difference in sensation here or here.
No.
Okay. All right. All right, Samantha, so I'm going to test just a couple more things for your sensory function here now. This is an extra test just because we did have those discrepancies. So I have two very identical objects. They're both soft. I'm going to touch them to your face. I will alternate either touching one side or both sides. So I want you to tell me, 1, if you feel it on one side or both sides, and 2, if you feel it on both sides, does it feel different? Okay.
Wait, what was the thing?
That's okay. So I'm going to touch you either with one or with both. So I want you to tell me if you feel it just on one side or on the both sides. If you feel it on both sides, just tell me if it feels different on this side and this side. Okay?
1, 2.
Does it feel the same?
Same.
Good.
1. Same.
Good.
Same.
Good.
1. Same.
Good.
1. Same. Same. Same.
Very good. Okay, so no discrepancies with that. You did really well. Now, same thing here. I have a different tool. Now this is going to simulate kind of like a finger scratching sensation, just a little more gentle. I'm going to run this down opposite sides. I want you to tell me if it feels the same. Now ideally it should feel identical. If it feels different, the pressure feels different, the sensation feels different, just let me know.
Okay.
Okay? Does that feel about the same?
Mm-hmm. Same.
Good.
Same.
Good.
Same.
Very good. Okay. So your sensory components do appear to be intact. Okay. All right. So I am going to test your ability to see through this slider here. So I just have an occluder. And I'm going to hold this up with one side occluded. Can Can you see me through the hole here?
Mm-hmm.
Do you see my pen here?
Yes.
Good. Do you see my pen here?
Yes.
Can you see my hand here on the side?
Like very faintly.
Very faintly, okay. And on this side?
It's faint.
Faint, okay. Let's see. I want you to tell me when you see a light.
No. 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 No.
Good, okay. So no issues there, that was very good. So I think the last thing I want to do for your CNE today is just do a brief inspection of the scalp. So you said you haven't had any injuries recently, no falls or hits to the head or anything?
No.
Okay. So I'm just going to do a quick palpation, feel around, see if there's anything concerning going on. So I'm just going to put a pair of gloves on. No allergies to latex, correct? Okay. All right. So I'm just gonna come around here. You just relax for me. So I'm gonna start off with some palpation. I want you to just let me know if anything is painful, uncomfortable, if you feel any tenderness. So I'm gonna start here at the base of the scalp. Good. I'm going to work up behind the ears. Any tenderness here?
No.
Good. Okay. Just feeling around the hairline. Good. Just feeling around the scalp itself for any abnormal lumps or bumps of the cranium, anything that could indicate an injury or just an abnormality of the scalp. So just feeling around. Okay, I'm going to come up here. Good. Very good. So we're nice and smooth. I'm not feeling any ridges, no lumps underneath the skin. Okay. All right, so just gonna have a look with my light, looking for any areas of abnormal color, redness, any signs of lesion or discoloration of the skin surrounding the hair. So I like to look at the hairline. No abnormal redness or discoloration. Your hair is nice and thick, so it tends to provide adequate protection from sun exposure. And hair itself is very healthy, not noting any breakage or excess dryness. Nice and shiny. Alright, so just going to come in with that same scratcher tool here. I'm just going to feel for any ridges that I might have missed. So if there are any areas that aren't as smooth, this will help me detect them. So far that feels okay. I'm not feeling any abnormal nodules. Okay, so while I'm here and your back is exposed, I'm just going to very briefly test those same sensory components with this tool. So can you tell me if this feels about the same as this? And here, and here.
Yes.
Good. Okay. Everywhere on your scalp feels the same. There's no difference in bilateral sensation. Good. Okay. All right. All right, Samantha. Let me just go ahead and grab my computer. Okay, so the good news is we have concluded your assessment today. So just came in for a checkup and everything looks great. I didn't notice any abnormalities. Your sensory components were completely intact. Your eyesight is obviously in good health. There's no signs of color deficiency. You were able to smell very well, hear very well. The only discrepancy was the sensation on your forehead, which I do think was just an anomaly because you were able to feel everything else. And there's no overall lack of sensation anywhere. Okay, so scalp and hair both look great. Did you have any questions for me?
No, I think that was it.
Pretty good. Okay. All right. Well, we could either get you scheduled ahead of time for your next annual visit, or you can just call in and let us know when you're ready to come in. I would recommend coming in a little bit sooner next time, but it's certainly up to your discretion. And then, of course, whenever you have time to make that appointment with your optometrist, just go ahead and do so. Okay? All right. Well, thank you so much for coming in. It was lovely seeing you today.